than any organization in Minnesota. Since '94, we have reconditioned donated vehicles so they have a higher tax benefit. Call Richard at 612-919-5526, 612-919-5526, or autotech.org.
With your AM 950 weather, I'm Patrick Lilia. Today, cloudy with a high of 78. Then tonight, a slight chance of rain and storms with a low of 71. Since 1981, the Great Wall Restaurant has provided the Twin Cities with a taste of Mandarin and Sichuan favorites. The Great Wall is located on France Avenue along the Minneapolis-Edina City line, 5 blocks north of 50th Street. Visit their website or place a takeout order at greatwallrestaurant.us.
Portions of the following program may be pre-recorded.
Good afternoon, everyone. Broadcasting from the studios of AM 950 KTNF, the progressive voice of Minnesota, and airing on WCPT 820, Chicago's Progressive Talk. Welcome to the Gaily Show. This is the only daily LGBTQ plus progressive radio news and talk show in the U.S. I am your guest host today. My name is Jake Whittick. I am managing editor of Windy City Times. We are Chicago's LGBTQ plus newspaper, having covered the city's queer community for 40 years now. Joining me today is Anna Deshawn, founder of E3 Radio and host of the Queer News Podcast. Anna also writes Windy City Times Black Lines newsletter, which provides news, features, and events for Chicago's Black queer community. Anna, how are you doing today?
I'm feeling good. The sun is shining in Chicago, Jake.
I know. Good. It's good, and it's not too hot. It's beautiful here. So
it is. It's beautiful.
Cool. Well, Anna's going to be with us for the next half hour as we discuss some of the top LGBTQ plus news headlines of Chicago and across the U.S. But before that, we are happy to share about Queer Gays, who partnered with Imagine Willow Creek Theater in Minnesota to present a new queer film on the last Sunday of each month. Get ready to laugh, cheer, and shed a joyful tear as Queer Gays celebrates queer films new and old. Tickets are on sale at imagine-entertainment.com/queer-gays. On July 27th at 2 p.m. will be Queens of Drama, an outrageous lesbian pop musical satire inspired by the pop frenzy of the early 2000s. Queens of Drama charts the rise and fall of new star Mimi Matamour and her passionate, rage-fueled love affair with punk icon Billy Kohler. Over the course of half a century, we follow these drama queens as they top the charts and set sail on the course of mad queer love. Again, tickets are on sale at imagine-entertainment.com/queer-gays. That's EMAGINE-entertainment.com/queer-GAZE. Now, back to our discussion with Anna. I have got a few different stories I'm hoping to talk to you about today. First up is a headline, a headline out of here in Chicago. And we've got reports that both Rush University Medical Center and UChicago Medicine have become the latest healthcare institutions to pause their gender-affirming care for minors. Crane Chicago Business broke the news on Friday that UChicago has discontinued its gender-affirming care for minors effective immediately. They said it was a difficult decision, but they felt they really needed to suspend this care for minors in order to ensure they can keep serving their patients who rely on Medicare and Medicaid patients, which make up the majority of their patients. This news at UChicago comes days after Rush University Medical Center also announced a pause on its hormonal care for new patients under 18. But that health system will continue offering such care for adults and its current patients who are minors. But this is part of a concerning trend that healthcare institutions across Chicago, Illinois, and the U.S. are rolling back their gender-affirming care offerings. In Chicago, these two hospitals follow Lurie Children's Hospital and Northwestern in suspending this care for minors. And like I said, we've seen this trend playing out across the country. So Anna, I guess to start off, what are your thoughts on this? How are you feeling seeing this happen?
Well, it's infuriating, right? I think it's happening because the Trump administration is putting a lot of pressure and making these hospitals have to choose. You're going to do that, then we're going to take this away. You're going to do that, then we're going to, cut your funding for Medicare, right? You're going to do that, then we're going to make your lives really miserable, right? We're going to make it so uncomfortable for you. You won't be able to continue to do your work. which is a dangerous game. It's a dangerous game that they're playing. One, because we're talking about real people's lives, real people's medical care. We're talking about children and young people who have been receiving this care for X number of years, and now all of a sudden it is stopped. That is dangerous business. It is not something we ought to be playing with. Two, it's a dangerous game because it's pitting people against each other, which is just another tactic of this administration to continue to elicit dissension upon people who are being harmed, and pitting one group against another group, poor people against queer people, Black people against Latinx people. This is the work of the machine, and it's not serving anybody any good. I think it is, and especially in the state of Illinois, that is meant to be a beacon of hope in the Midwest for folks seeking gender affirming care, right? Especially because we're a state that protects it. But you
Yeah.
have private institutions that are making these decisions because they're being put in unreasonable and untenable positions to have to choose between. How can you choose between gender affirming care and Medicare? This is an impossible choice. And what's happening is people in our community are the ones that are losing out.
Yeah.
People in our
Yeah.
community are the ones that are being harmed.
I like how you said it's a game to them, and it's sad that it is a game to them because this is not a game. Like, people's lives are at stake here.
Yeah.
People are going to actually be harmed by this decision, and I just really, like, my heart goes out to the youth who have been depending on this care and now find themselves losing it. I just think about the mental toll that must take on someone, and I hope that at the very least they're at least still connected to mental health services that can help them through this rough time, because I really worry about that mental toll.
Because gender dysphoria is real.
Mhm.
It is documented. It is a very real disease. And the cure, right? The way that we combat gender dysphoria is being able to provide gender affirming care.
Yeah.
And so if and when, actually, this I read the article, right? This is now immediate. They no longer provide it. And so where do those young people go?
Yeah.
Where do
Yeah.
they go to seek their care? Anybody out here who's had to deal with the health system, you know how important your primary care physician is. You know how important your care team is to you. They know you. They know your family. They know what you've been through. They know your story. There's an investment there. So now you're telling these young people and their parents that now we can't do that for you. So you have to find somewhere else.
Yeah.
What? So now what? I mean, it is the most un-American thing. Actually, that can actually be happening to these young people in this moment and to these families. I firmly believe these healthcare decisions ought to be made between their families, these families, their doctors, their physicians, their care team. It has nothing to do with politics, but they're making it about politics so that they can win some votes,
Yeah.
right? It's easy to pit people against each other. It's easy to demonize the most vulnerable among us, and they've done a masterful job of it.
Yeah. And here in Illinois, the state's done a lot to really position itself as a safe space for trans people. We have families moving to the state to access this care. And now it's just getting harder and harder with each hospital that suspends it for them to actually access the care they came here to receive. But I guess what does give me some hope is that politicians across Chicago and Illinois are taking a stance against this, whereas maybe in other states, they're just kind of letting it happen, or some Democrats might even just be looking the other way. But here in Illinois, like Attorney General Kwame Raoul was among 14 other attorneys general in February who vowed to protect access to this treatment. Our Chicago City Council passed a resolution last week condemning the hospitals that have suspended this care. And then the city and state, they also have shield laws protecting access to gender affirming care. But what I read in the Chicago Sun-Times is State Rep Kelly Cassidy said, these shield laws are great to protect access to that care, but they really can't withstand these federal attacks. So it's just really unfortunate that people who are coming here now might not even be able to access it. I know activists are planning protests around this. They're also trying to identify health institutions across the state that are still offering this care so that they can support families that need it.
And I think that that's really going to be the key. I mean, these legal battles are so important. I know we got a couple more stories that I think illustrate just how important the legal battle is. And the people have to rise up in these moments, and it's community that's going to take care of each other. So if people are moving here because we are a brave space for LGBTQ folks, we have a lot of protections in this state. To your point, we got a lot of politicians that support, right, LGBTQ issues and humanity. That this is the time where we have to find the institutions that are supporting it, and the people that are at Rush, at UI, that these hospitals that Deuce and Lori that do support it but aren't able to provide it, can provide support to these other institutions that can.
Yeah.
I think it's a time where the people who are in those hospitals who are being mandated not to have to figure out ways that they can show up for the people who can, because the Trump administration, their whole goal is to go after the big people, right? The largest dollars. Okay. That's going to keep them busy. It's keeping us busy, the people doing the work busy. But then the people who they can't see so readily or so easily, how can we support them to be able to support the community? I think we have to figure out how we take care of ourselves in this moment.
Yeah, I also worry about the bandwidth of the state to support everyone at this moment. There were already concerns, not concerns. The state has welcomed every family that's come here to receive such care, but just questions whether our hospital systems even have enough culturally competent, doctors and physicians and everything to support these families with trans people. And now with fewer and fewer hospitals offering this care, it might be harder and harder to support everyone coming here.
100%. And that's exactly what they want.
Yeah. Well, I'll tee up our next story. We'll have to go to a break soon, but another big headline this week is I really want to highlight the recent protests over the federal government's decision to shut down the LGBTQ plus option on the 988 suicide prevention lifeline. And this has been it launched in 2022, and it's proven to be quite helpful to people. More than 1.8 people have used the LGBTQ plus line in the few years since it launched. And advocates say it's been really crucial for youth in crisis. But as of last week, the option it's gone under the Trump administration. And it's a little ironic because it launched under Trump's first administration. And now his second one is the one to roll it back. But it's just awful. Real quick, Anna, what are your thoughts?
I'm just glad that there's other options. I mean, this is the attack. This is the plan, right? It was all outlined line by line. Okay. And they are successfully executing it. Now, like I said, it's time for the community to take care of the community. And I'm glad that there are other options. The Trevor Project, Trans Lifeline, the LGBTQ National Hotline, the LGBTQ National Youth Talk Line. There are other places that people can call. We just got to get the word out that these places are available.
Yeah, totally. And this is like we were saying earlier, it's a game to them, but this is not a game to us. These are everyday people, real life people. It's going to have actual harm, and it's just awful, And I remember being in high school, watching the debates over marriage equality and don't ask, don't tell, and the mental toll that took on me as a kid. I just feel so bad for the kids seeing these escalating attacks on their rights as they're at an age where they're coming to terms with their own identities and seeing that they're under attack.
Yeah, the other day it was wild. I said, I feel like I'm in my auntie bag for real now. Because when we talk about the next generation, it is not me anymore. I am not the next generation.
Right.
Right. This is a moment where we really can put into perspective what it means to fight for the next generation's rights.
Right? We're going to take a break here, but we'll continue this conversation when we're back. Again, you're listening to The Gaily Show. I'm your guest host, Jake Whittick, and we're with Anna Deshawn.
July is the annual store-wide sale at Woodland Stoves and Fireplaces. Come see our diverse selection of wood, gas, or electric fireplace products for indoor and outdoor living. And right now, Woodland Stoves and Fireplaces can assure you the best price of the season on every product in the store. Let Woodland Stoves and Fireplaces help you choose and experience the joy of sitting by a fire.
Summer is a great time to install your fireplace. You can find your perfect fireplace and have it installed and ready before the cold weather hits again. If you already have a wood fireplace, consider a fireplace insert. Come and see the entire selection at Woodland Stoves and Fireplaces on East Franklin and Riverside in Minneapolis. They will create a fireplace that works for you. Efficient, clean burning, and environmentally smart.
Woodland Stoves and Fireplaces, since 1977, out of the ordinary products and services to make fire work for you.
Hey, it's Patrick for Zero Res. The month of July is National Carpet Cleaning Month, and because of that, Zero Res is offering a purchase of 3 rooms of carpet cleaned. Get 1 room free plus $50 off an air duct cleaning. Maybe you're having a barbecue for the 4th of July. We'll also have Aquatennial coming up in Minneapolis later this month. You want to make sure your home is fresh and clean for your friends and family coming over to celebrate. If your carpet's looking more like a snowbank in late March, muddy, crunchy, and kind of mysterious, it's time to call Zero Res, don't you know? These folks come in with their fancy schmancy ZR water. It's like regular water, but with a master's degree in cleanliness. Zero Res can handle it all. Carpets, tiles, rugs, upholstery, air ducts, basically every surface in your home can be Zero Resified. So it's time to call the cleaning pros at Zero Res today. Schedule your appointment at ZeroResMinnesota.com or call 952-ZERO-RES and ask for the AM 950 special. Backward or forward spells the same. Zero Res.
Think your company's safe? Your staff is working from home, right? As I speak, cyber criminals are mounting attacks across the country. Remember, when we're weakest, cyber criminals attack. Hi, Mark Sommerfeld from Rymark. The Rymark team is guiding our clients through these difficult times. In fact, demand has been so high, we created an easy-to-follow guide. It's yours free. Download our 5 steps to securely work from home now at rymarkit.com or call 651-328-8900 for a no-cost how-to discussion.
Chanhassen Dinner Theaters brings you its most popular show of all time, Grease. You'll hear all your favorite hits from the Broadway musical and the movie. Join the whole gang at Rydell High. We'll sing, we'll dance, we'll bring you back to high school life in the 50s. Poodle skirts, bobby socks, the soda shop, and drive-in movies. Grease, it'll rock your socks off. Order your tickets today. Visit chanhassendt.com.
Hello, everyone, and welcome back to the Gaily Show. My name is Jake Whittick. I am filling in for John today, and we are joined with Anna Deshawn, founder of E3 Radio and host of the Queer News Podcast. She is here. We are right now talking about some of the top LGBTQ plus headlines of the week. Right now, we're talking about the LGBTQ line on the 988 Suicide Prevention Lifeline and how that effectively was ended last week due to cuts within the Trump administration. Obviously, we were talking about how horrible this is and the harm it's going to cause, but I do want to offer a glimmer of hope for where we're at in Illinois. And that is that the LGBTQ part of this lifeline is going to continue in our state at least. Governor J.B. Pritzker and the Illinois Department of Human Services affirmed that the LGBTQ plus option on the 988 lifeline will be preserved in this state despite the federal cuts. And the reason this is because the 988 contact centers in Illinois are funded by our Department of Human Services, and that department has worked to make sure that they still have the money to fund this program despite the cuts at the federal level. Another good thing is we have lawmakers in our state who are working to defend this lifeline, not just in Illinois, but nationwide. And that includes U.S. Rep. Raja Krishnamurti, who sent a bipartisan letter to the Trump administration last month urging them to reverse this decision. So I guess, Anna, I wanted to talk to you a little bit about how you're feeling to hear that it is at least going to continue in Illinois, and maybe your thoughts on what we can be doing to make sure other states can still receive this vital service as well.
I mean, that's fantastic news. And I mean, I think this is why people are moving to Illinois, because we do have a governor that's willing to stand up and fight against Trump's discriminatory policies. Right. We have a mayor that has said that he is standing by the LGBTQ community. I mean, this is why people want to move here, who are fleeing and are truly refugees in their own country, right? Having to flee other states because of the lack of care. I think it's fantastic because we know the impact that these bills, the legislation, the culture, the commentary on social media, we know the impacts that this is having on young people. Because of the rates, the number of calls these 988 suicide lines receive. I mean, I reported on this a couple weeks ago. I mean, I think the numbers are at like over 1 million.
Yeah, what I have is 1.8 million have used the line, and it's available via text and call.
That is insane. That is a public health emergency.
Yeah.
The fact that many people needed a lifeline, right? that didn't exist maybe in their home. They didn't have anybody else to talk to. They needed a safe space. And for me, and I think this is how so many people in our community feel, is that this is so tragic because for us, one person is too many.
Yeah.
So to think that there have been over 1 million, right? I mean, this is a crisis. And I think what's clear too is that, right, in this moment in time, the state, and I mean not Illinois itself, but the federal government could care less. Another thing, Jake, you mentioned that was giving you hope, and the fact that the state is being able to continue to fund this, which I think is fantastic, that they were thinking ahead and planning, right, for this moment that was truly inevitable in some ways. I think one thing also that gives me hope is that queer folks for such a long time had to live outside of the system because the system did not protect us, right? Not my generation. The people before us fought so that we could work within a system, right?
Yeah.
That our tax-paying dollars fed into. But now we're having to take their lessons on how they lived outside of the system and how they survived and how they took care of each other and all the ways in which, they were able to still live full lives even without the full representation or the full humanity of themselves being seen in our political landscape. So
Right.
I think the fact, knowing that there have been generations before us that were able to survive without federal protections gives me hope that in today's society, with technology, with the way in which we can connect with each other through social media, through all these other ways,
True.
that we'll be able to get through this moment too. And it's going to be just as hard as it's always been.
Yeah.
I just think this is our generation's fight in this moment.
And we have each other. We've always had each other, and we're going to keep. Yeah.
We always have. We've always had to. I think it's so interesting. Like, Jake, right? Like, okay, I know this is going to sound like a wild analogy, but there's commentary around what integration did to the Black community, right? Let me just take this as an example. My mother grew up in an all-Black town in Mississippi, right? Black banks, Black hospitals, Black grocery stores, everything was Black owned because it had to be. They had to survive. They had to do that. And so all the money went back into their community. Integration hits, and now everybody can go to all the other places, and now everybody can go to all the other things. And then the town loses the money. And then, right, the hospital closes, the restaurants close. You're right. All these things happen as an effect of people leaving the communities. Child, we were in a moment where it felt like we were getting integrated into society. Yes. And now they're saying, no, you're not welcome. And so, family, we have to figure out how now we go back inside, back to ourselves in some ways to ensure that we can survive this moment.
Yeah.
Because this is just, it's devastating on a lot of levels. And with the Supreme Court being as conservative as it is, we're not in the 5-4 moment anymore. We're in a 6-3
It's important
moment.
we stay organized. Yeah.
This onslaught is not going to stop anytime soon. We've got 40-50 years of a fight here.
Totally. Well, thank you for sharing that perspective, Anna. We've got just a couple more minutes with you, and I want to make sure we have time to talk a little bit about E3 Radio, where people can follow your work and the Queer News Podcast. So do you want to tell us a little bit about what you're up to?
Absolutely. Family, I'm your favorite queer radio personality. Okay, we out here every Monday dropping 5 or 6 queer news stories that you should know about. And this week, I did a special episode. I got an opportunity to interview Jose,
maybe Abrigo.
Yes, Abrigo from Lambda Legal about the case, right? This $6.2 million has been restored to 9 LGBTQ organizations in California, which was a huge win. And so we got a chance to talk about that. So if you want to hear more about that story, family, you got to tap into the Queer News Podcast. You can listen wherever you listen to your favorite pods.
And the website is?
e3radio.fm.
Yeah, go there, sign up for Anna's newsletter. I get it every Monday. It's great. And you also write another newsletter for Windy City Times. Do you want to tell us a little bit about Black Lines?
I do, and I love Black Lines. I love talking about Black LGBTQ life here in Chicago. If you want to get tapped in, if you're traveling to Chicago and you're wondering what you're going to do, what you're going to get into, what's happening, tap into Black Lines. Subscribe ASAP. Go to Windy City Times and subscribe. It's a fantastic newsletter. Jake does an amazing job curating the stories, telling the history, sharing events. It's a fantastic newsletter.
Yeah, it's a lot of fun. It's a monthly newsletter. It's out the fourth Wednesday of every month. So we actually have one out this Wednesday. To sign up, go to windycitytimes.com/newsletters and check Black Lines. We've also got a few other ones. Another one I enjoy is En La Vida, which is kind of Black Lines' sister newsletter, and that is for Latinx LGBTQ plus people. So we've got a lot of options from events to news to more culturally centered newsletters for people to check out. It's a lot of fun.
It is. Y'all know y'all doing it. If you're listening to this, I know you care about local media. I know you want to support it. And so this is other ways you can do that.
Well, we're going to fit in another break here. Thank you so much for joining us, Anna. It's been a lot of fun talking to you.
Thanks for having me, Jake.
Yeah, have a great day.
You too.
This is Santita Jackson, Minneapolis, St. Paul. I couldn't be more excited about starting.
All right, so I've paused us. We're not live on the radio right now, but we are still live on stream. So anything that's said can still be heard on the live stream. So I'm going to bring Maureen into the studio.
Awesome. Hi, Maureen.
Hi. Can you hear me?
Yeah, and just FYI, we are live streaming on YouTube right now, so people can't hear. So.
Hi, YouTube.